If your loved one had a stroke, would you know what to do? Well, May is actually National Stroke Awareness Month, and it's important that we are educated and aware of how to help those when in need. And here to tell us more, we have neurologist Dr. Hassanby, actually, and along with us, we have stroke survivor, and great to have both of you on here. Dr. Hassanby, can you please help our viewers understand, though, what exactly is a stroke?
A stroke is the interruption of brain function. There are two types of strokes. 15% of strokes are hemorrhagic strokes, a bleed caused by an aneurysm most of the time or some other vascular lesion. And most strokes actually are called ischemic stroke, and they're caused by a clot traveling into an artery of the brain and interrupting blood flow.
Okay, so what are the signs? How do we know if someone is actually having a stroke?
So it's very important to know, to recognize the signs, because unlike a heart attack, a stroke is not painful. So the most common reflex when somebody has a stroke is to just go take a nap, and then you're missing out on the time window for treatment. So one easy way to recognize an easy mnemonic for stroke is FAST. So face, arm, speech, and then T would be time to call 911. So you look for a facial droop, you look for arm weakness or numbness, a drift, you look for speech trouble, either inability to speak or word finding difficulties or slurred speech, and then T stands for time to call 911. And that's a very useful mnemonic that's been successful in educating lay people.
And why is it so important that we take the action quickly, like you're mentioning?
Because you have a short time window. Studies have shown that patients who were treating in the early stages of a stroke with intravenous drugs, the clotbuster TPA, if they were treated within 90 minutes of the onset of the stroke, they had 3 times higher chances of recovery as compared to those who were treated later.
Wow.
Absolutely. And for those, about 10% of all strokes who have a large vessel occlusion, a large clot, who are eligible, therefore, for an intervention to go through the groin, through the arteries, and remove the clot, those that were treated within 2.5 hours of onset had 90% chance of recovery compared to others
That
treated
is
later.
incredibly significant, right? So like you're saying, that time window is so crucial. And this is something that you experienced. So tell us, what were your signs? Did you know that you were having a stroke?
I didn't. In my situation, my stroke was about 12 years ago, and before that I was very healthy. And in my situation, my first sign was a headache.
Okay.
And so I had 3 children, and I just delivered my 3rd child, and I was home, and I thought maybe I didn't get a good night's sleep the night before because I was up with the newborn.
Right. A headache with a newborn is nothing. I mean, that just comes with to be expected.
So I went to bed that night, and then I woke up about 4 in the morning, and I told my husband I couldn't move. Then my whole right side was totally gone, paralyzed. And then he said I wasn't making any sense. My speech was kind of slurred and off. So he called 911 and got me right away to the hospital.
And can you please, and I'm so sorry because we're limited on time, but the best that you can, what has your road to recovery been like?
Well, it never ends, but the first 2 years were really, really intense. I had speech therapy, physical therapy, cognitive therapy. It was great because I had my children at home, and they became my teachers. I would do their homework with them. My baby was learning to crawl, and I would get on the floor and start crawling with her. I was just trying to follow their normal neurological development. They were my best teachers.
Oh my goodness.
Yeah.
Oh, you're going to make me cry.
But I still work at it. You know, you never stop. And so I just encourage all people to keep working at it. You know, we have a great community in Sacramento of stroke support.
Yep, and great role models like you and spokespeople that are speaking out about your experience so others can also be aware. And clearly, doctor, the whole point of this is prevention. Is there a way to prevent this?
So we believe that about 80% of strokes could be prevented through changes in lifestyle. Not smoking, making sure your blood pressure is under control, making sure your blood sugar is under control, as they say, knowing your numbers, eating healthy, exercising. All of these life measures could possibly prevent as many as 80% of strokes.
But like Ann said, she was relatively very healthy. So you never know. So once again, knowing those signs are so incredibly important. Where can people go for more information?
People can go to the American Heart Association website, heart.org, and that's a very, very good source of information as far as prevention, life-changing measures, nutrition, all kinds of useful things.
Both of you, thank you so much. Greatly appreciate it. And once
Thank
again,
you.
thank you so much for sharing your story. Very
Thank you.
impactful. And Doctor, thank you for all of
you.
your knowledge.
This interview involves commercial content. The products and services featured appear as paid advertising.